ICD-10 codes for C5 spinal cord injury. Functional quadriplegia, ICD-10 codes for C5 spinal cord injury. Functional quadriplegia, ICD-10 codes for traumatic brain injuries and spinal cord injuries are based on the International Classification of Diseases, ICD-10. This new system includes 22 code sets for describing a patient's neurological and physiologic status following a traumatic brain or spinal cord injury. The ICD-10 classification is a step in the right direction for a patient who has suffered an SCI. Although the ICD-10 code sets a general standard for describing SCIs, there are nuances in the definition. Some codes describe a condition as having a very low risk for paralysis, while others may have higher or lower than average risks. In any case, the most critical question is whether a C5 spinal cord injury is a symptom of another disease. A diagnosis of a type of SCI should be based on the cause of the condition, not on the type of injury. The ICD-10 diagnosis for C5 spinal cord injury is not always clear. The coding system doesn't have adequate sensitivity for spinal cord injuries. Some codes have high sensitivity to traumatic injury, while others have very low sensitivity to the injury. For instance, one type of SCI is more likely to result in a stroke than another type. There are other types of SCI, which require different documentation methods and a specialist's assistance. C5 spinal cord. A retrospective register-based epidemiological study conducted in Finland found that C5 spinal cord injury was the most common form of SCI. It was estimated that 28 out of every 100,000 people had SCI. The researchers aimed to identify all adult citizens of Helsinki who had permanent motor and sensory disabilities. The researchers used 3 local organizations to conduct their analysis. The study also found that the ICD-10 codes are unresponsive to detecting SCI. In a recent study, a Finnish population-based epidemiological study using 11 ICD-10 codes for C5 spinal cord injury found that the rate of SCI was 28 per 100,000 people. The study's primary purpose was to identify all adult citizens of Helsinki with a permanent sensory and motor deficit. The registers included the Kapaila Rehabilitation Center, Helsinki University Central Hospital, and a local organization for the disabled. However, the findings suggested that ICD-10 has limited sensitivity. A person with a C4 spinal cord injury may need a personal care assistant and a ventilator for breathing. The reason for this is that the phrenic nerve controls the diaphragm, which is the major breathing muscle. A C4 SCI can cause the patient to be unable to breathe normally and may require a ventilator to breathe. In this case, the patient needs to be monitored for several days to ensure a normal recovery. There are several types of C5 spinal cord injury. The injury can occur anywhere along the cervical spinal cord. It can also be caused by traumatic brain injury. The thoracic SCI is the most common and most serious of these injuries. Depending on the severity of the spinal cord injury, the patient may require immediate medical care. During a hospital stay, a doctor will need to stabilize the neck and the spinal cord. Some surgery and medications may be needed to reduce swelling and inflammation. Damage to the soft tissues or bone in the cervical spine is a common cause of SCI. If the C5 spinal cord is damaged, a patient may suffer from a partial or complete loss of function. The C4 SCI is often the most common type of cervical SCI, and is the most common type of cervical SCI. It is the most fatal type of SCI. Fortunately, there are treatments for this condition. There are several different types of C5 spinal cord injuries. The C5 spondylomyelia is the most common type. It is located midway down the cervical spinal cord. The risk of complete paralysis increases as the C5 is injured. This condition is more commonly treated in the early stages than in traumatic SCI. When it is detected early, it is possible to minimize the risk of a complete spinal cord injury. Read this. What does functional quadriplegia mean? Functional quadriplegia, quadriplegics, quadriplegics.